But then it comes to practitioners. I met different people, so many different people at different crisis points, and some of them were very good in terms of limits of what they could do. But also there are many people in inappropriate place. They should not be dealing with people because they don't have people skills. Okay?
Thank you.
When I live in my body for 40-something years, I know how my body works.
Exactly.
Okay? When I'm telling you something, you listen. Because I'm an expert of how I feel, right? They don't listen. This is one problem. They only care about giving you pills and medications. There is hardly anything except that. Well, therapy, but let's face it, unless you can have private one, the one that is offering NHS...
It's absolutely shit. I've tried it as well. I've tried it. I've thought to myself...
Exactly. You know, if there is nothing else, and why should I always subject to medication? I don't understand. You know, it's not always the solution, right?
And even we know now, right, medication, which some people call it man-made medication and all of these things, all of us know that medication doesn't really help in the long run, right? Medication doesn't help you in the long run.
It's a temporary solution. Of course, some illness require medication to ease your symptoms or to stabilize you. Fine. I'm not saying don't take medication. I am taking medication. I'm on lithium, you know. But there should be something else. This is not the only way we should look after the patients with mental health.
It's true.
Of course, but let's face it. When I'm suicidal and depressed, fuck it. I don't care what is there for me. I just care about killing myself. You know what I mean? If there is nobody to somehow, get me out of there to offer help, myself will not help myself. Because I'm incapable in that moment. You know what I mean? And this is the problem. People suffer in silence, suffer for weeks in bed or house, locked up, because they don't have the strength to ask for help and do things. Like, do you know how many times I need to chase my appointments, my blood tests? Okay, I am pretty high functioning, so I'm doing it. But how many of people with illnesses like mine, they are not capable of doing it. Who is treating who here? Am I treating myself? It's like, why should I chase you for my blood test? You should have it in the system, the flag up, on you for the blood test. Why I'm chasing it?
I don't